Did you know that around half of all heart attacks might not even feel like what we expect them to? That's right, 45% of all heart attacks are silent. They don't come with the dramatic chest pain that we see in the movies. Instead, like undercover agents, they cause damage without making their presence known. Hello and welcome back to Dr. Saalaar channel. I am Dr. Fatima, and in today's video, we're going to talk about 6 signs of a silent heart attack. So if you want to detect it early and prevent complication, stay with me until the end of this video and let's go. Myocardial infarction or heart attack is when the flow of blood to a part of your heart is blocked. And this blockage has been there for long enough time that a part of your heart muscle is injured or dies. This is most often caused by a blockage in one or more of your heart's arteries due to a plaque, which is a mix of fat, cholesterol, and other substances. Now, imagine all of this is happening in your body and you're completely unaware of it. That's the reality with silent heart attacks. You might not have that intense chest pain or that unbearable shortness of breath, but the damage is being done all the same. The complications of a silent heart attack are as serious as the complications of a more noticeable heart attack. After a heart attack, parts of your heart muscle that have been damaged may weaken, leading to a heart failure. Damaged heart tissue can also disrupt your heart's electrical system, and this can lead to irregular heartbeats, which can be life-threatening. Alright, now that we know how important a silent heart attack is and what are the complications, let's talk about who is more at risk of having a silent heart attack. The first group are the people with diabetes, because diabetes can cause nerve damage. And this nerve damage might dull the usual pain signals that alert someone to a heart attack. So someone with diabetes might have a heart attack and not realize it, because they might not feel the typical symptoms. Women, on the other hand, might not have that classic chest pain symptoms and instead have some subtle signs. It can be shortness of breath, nausea, or back or jaw pain. As we age, our bodies don't always signal the pain the way they used to, and that's why older adults are also a high-risk group for silent myocardial infarction. Those who already had a heart attack before are another group that should be aware. If someone has already had a heart attack, their ability to recognize new symptoms might be compromised, either because they think it is something they've already experienced or because the previous damage affects how they feel pain. Alright, now let's talk about the little signs that silent heart attack might show. The first one is a mild chest discomfort, pressure, or tightness. Unlike the overwhelming chest pain that is typical in heart attacks, silent heart attacks might manifest as a mild, uncomfortable pressure or tightness in your chest. And that's the problem, because this symptom might be mistaken for an indigestion or a muscle strain. But something that you should know is that a chest discomfort that stems from your heart is more likely to persist and recur. And this recurrence especially happens when you have physical activity or stress. The next sign is shortness of breath. Experiencing breathlessness without having exerted yourself can be a sign of silent heart attack. This symptom can be confused with conditions like asthma or anxiety. However, the shortness of breath that is related to your heart often happens without an obvious trigger, and it tends to persist. Unexplained tiredness, especially when you feel unusually exhausted after routine activities, can also be a sign of a silent heart attack. Well, fatigue is a common symptom in a lot of conditions. But if it doesn't go away with enough rest, make sure that you get yourself checked up. The next one is nausea, stomach pain, or abdominal discomfort. These signs are misleading, often attributed to a food poisoning, viral infection, or a gastrointestinal issue. However, they can also be a sign of a silent heart attack, and in that case, they're going to be persistent and not related to what you eat. The next sign is feeling lightheaded or dizzy without any obvious reason. While dehydration or sudden changes in your position can cause similar symptoms, when they are associated with a heart issue, they might occur spontaneously and be accompanied by other symptoms like breathlessness or fatigue. And the last one is sweating, an intense type of sweating that happens without the usual triggers like heat or exercise. Breaking out in a cold sweat without having done any exercise or being exposed to high temperatures can be a sign of a silent heart attack. All of the symptoms that we mentioned can be associated with a lot less serious conditions as well. But what's important is that you know when to be alarmed. If you have any of the symptoms that we mentioned and they either persist or keep coming back over time, it's time to seek medical help. Because although these symptoms might not seem severe, if they persist, they might signal an underlying heart issue. Another thing that is very important is for you to know if you have any of the risk factors for heart diseases. Some of these risk factors include high blood pressure, high blood cholesterol, diabetes, a family history of heart disease, smoking, or a sedentary lifestyle. So, if you have some of these risk factors and you're starting to notice some subtle changes in your health and well-being, consulting a medical professional is the best thing that you can do before it's too late. And always remember that your heart health is too important to leave to chance. Thank you guys for watching until the end of this video. Don't forget to like and subscribe and leave your thoughts in the comments. And until the next video,